It's a beautiful day here in Lagos, Nigeria, and I'm presently at the official launch of CoElevate, a catalytic fund designed to improve health innovation in Nigeria and across West Africa. My name is Mary Queen Aizobu, and I'll be your red carpet host for today, bringing you all the energy, brilliance, and innovation walking through those doors. Come with me. So we have here the MD of SFH Access, and we are live at the CoElevate launch this morning. Good morning, sir.
Good morning. How are you?
Fine, sir. So you're looking very ready for this launch today.
Absolutely. We've asked for it, we've prepared for it, and here it is today.
All right. So, sir, SFH Access has always championed access to sustainable healthcare. How does CoElevate align with this vision?
So for us, CoElevate align with our strategic pillars, and our strategic pillars are hinged around equity, hinged around innovation, and hinged around how we address the determinants of health. So CoElevate for us, it's an opportunity for us to look at those scalable ideas that can bring about transformative solutions. And there are a number of people who have those scalable ideas, who have those ideas that can actually help to bring about a total transformation in the healthcare sector in Nigeria. And what CoElevate is here to do is to support those ideas and ensure that they come to scale.
That's amazing. All right, sir. What advice do you give to innovators that are trying to get this grant, that are trying to get the CoElevate fund?
I think for us, it's for them to come upstream. They should come and demonstrate their ideas, and to show that those ideas can provide solutions. Once the solutions are testable, they are sure that if they apply through our funding stream and our funding system, we'll be able to support their ideas. So for us, I'm looking forward to how this and the advisory board will take this to the next level for the funding, for the stream 2 that we're looking forward to come up shortly after this unveiling or this launch.
Thank you very much, sir. So that's a very nice approach to getting Nigerian innovators and West African innovators as well to get in touch with healthcare and sustainability. So how does this align with your personal goals as the Managing Director of Society for Family Health Access?
So for me, like I said, it's a way of contributing Africa, investing in Africa. So it's an opportunity for us to look at locally grown solutions, and then able to test this solution using the entire network of SFH and SFH Access. And then we believe that this would help to begin to show or demonstrate to people out there that whatever ideas you have can be tested, can be supported, and can be scaled to provide the solution that is needed for us to bring about that.
All right, sir. Thank you so much for chatting with me. I wish you an amazing experience in there.
Thank you. And I look forward to how this will continue to impact Nigerians and the greater society.
Amazing. Thank you, sir.
Thank you.
All right. Okay, I have my second guest on the red carpet right now, and we have here Dr. Jennifer Anyanti. She's SFH DMD. Ma, welcome to the red carpet of CoElevate.
Thank you.
Yes, ma. Okay, so ma, CoElevate is launching at a very crucial time in across Nigeria and West Africa, and innovators are going to benefit from this. What does this mean to you personally?
Okay, thanks very much, Mary Queen, and it's lovely to be here actually, and I'm so excited, to be honest. This is a time when there's quite a dip in donor-funded programs, even donor acceleration of young people's programs. And so for me personally, I feel this is like a dream come true, because this is an opportunity for, many of us may have had ideas, plans in the past, but there were no opportunities for us to be either funded or for us to have an accelerator that helps us to build the abilities that we have to be able to fund programs, the future that is needed in a country like Africa in general. And so I find this to be, just something that I've always wanted to be part of, because this is an opportunity for us to build the next generation of entrepreneurs, of innovators, of those that will address the key health challenges in Africa. And so we're here and we're about to launch. So I'm so excited.
Thank you very much, ma. So what advice would you give an innovator like trying to get this CoElevate grant?
Okay, well, first thing, of course, attend. But apart from that, we're launching a website. It's called a website. And so go to the website and study first. Look at whether you fit into the pedigree of those who are supposed to be receiving the funding. Also take a look at whether you're the area where your passion is, because passion is key. So the area where your passion is, does it align with either a WASH intervention, pharma R&D, non-communicable diseases, adolescent reproduction, any of the ideas that are part of the CoElevate accelerator. And if it does, then you just apply. Just first of all, just apply. That's what I just like to say. Any young person out there looking for an opportunity to expand, to enlarge, who has that bright idea that's going to change the world, just go ahead and apply.
All right, you've heard it here from Dr. Jennifer Anyanti. So apply for the CoElevate Fund and we'll look forward to working with you in SFH Access. Thank you very much for chatting with me, man.
You're welcome.
Have an amazing experience.
Thank you.
All right, so I have with me Dr. Omokhudu Idogho, Managing Director of Society for Family Health Nigeria. So welcome to the event today, sir.
Yeah, thank you very much. It's a real pleasure to be here and to witness history being made today in the city of Lagos and in the Society for Family Health ecosystem. So a real pleasure.
All right, sir. So what outcome from CoElevate would you look back and say, yes, CoElevate works?
I think in the health space, there's never been a time like this where we need all the local solution, all the expertise, the energies that is what I call cross sectors, from technology, from the idea of research and development, from the space of what we call the determinants of health. We need to bring all this together to solve the problems we have, even as we accelerate towards 2030. So what will be success for CoElevate is when we're able to max the strength, the ingenuity, the amazing creativity of the Nigerian people, of the West African people for the health ecosystem. So the solutions that will come out from here, transforming lives, making things easier, improving access, and accelerating the subcontinent journey to universal health coverage.
Thank you, sir. So, okay, what advice are you going to give an innovator out there looking forward to receive the CoElevate grant?
Yeah, thanks. I think the starting point really is that you need to figure out a problem, a big problem you want to solve. And I think one of the experience we've had within Society for Family Health is that we think long term. We think more of how we serve communities. So with your eyes focused on how your solution will serve communities, we serve the women, the girls, the boys, the men out there, the more likely that that solution is going to be successful and that it will have the appropriate revenue profile. So let's focus less at this sort of creative time on what we see as benefit. Let's focus on creating solutions. And ultimately, those solutions will generate the revenue profile that we seek. And so that's my message, that let's put on our best creative hat. Let's always think about the communities, the people for whom these solutions, we are crafting them.
Thank you so much, sir, for taking our time to chat with me. I wish you an amazing experience in there.
Thank you, my pleasure.
All right, so I have with me pharmacist Ahmed Yakasai, MNI. He's the board chairman for SFH Access. So, sir, welcome to CoElevate launch today. I'm going to ask you, why is SFH, what's the SFH's aim by bringing up the SFH Access Catalytic Fund?
Thank you very much. SFH Access is a very progressive organization, very young, but they are always thinking ahead. And we know we cannot survive, especially the healthcare landscape, cannot survive without embracing technology. So today is a significant milestone where SFH thought of bringing young innovators to bring about innovation and equitable access to healthcare for all. We're talking of affordability, possibly accessibility, and everybody as a fundamental human right to have access to healthcare. So they are bringing young guys, startups company, as what they call CoElevate Catalytic Fund. They will have small money. I am not saying big money, but to encourage and motivate young innovators in Nigeria and possibly expand it to Africa. So that is why today we are here to unveil that funding system of encouraging the young ones who can help in bringing more innovation into healthcare landscape.
Thank you very much, sir. Sir, I know you're a major player in the overall healthcare, and especially in the pharmaceutical sector. So how does CoElevate align with this?
Yes, you see, we are talking of, apart from local production, we are encouraging local production, but at the same time,
distribution is one aspect of the whole ecosystem, especially when it comes to national drug distribution guidelines, national drug policy. We are looking at a way a company like SFH Access will encourage local manufacturers to produce quality products and they can distribute for them. At the same time, expand into larger production of many products. Right now, we are producing hygiene products, but definitely with time, with the approval of the board of the larger Society of Family Health, we are going to go into big time manufacturing of pharmaceutical products. So definitely SFH Access is a great player. They have made name already. They have quality products from, they are importing, but they are buying locally and they are manufacturing. You know, when you talk of WaterGuard, when you talk of eye clean, when you talk of top mal, when you have talk of Gold Cycle, when you talk of so many diabetic, non-communicable diseases, medicines, they are there and they are giving quality product. You need to see the products. Very lovely, and what is inside, very effective.
I've actually tried the top mal. So
yes, so it's fantastic. They are contributing a lot, and I'm really proud to be the chairman of the board to give direction. I'm not into day-to-day activities of the company, but I will try as the chairman and board members to give direction to where they will go. And we'll keep on encouraging them. We'll keep on motivating the staff. The workforce, they must be motivated. They must be really remunerated well, incentivized. The distributors are happy. We give them a lot of incentives. And so I'm telling you, SFH Access is a great company and it's doing well.
Thank you so much, sir, for taking our time to chat with me. I wish you an amazing experience in there.
Thank you very much.
Thank you so
You're
much.
welcome.
All right, so I have here with me Dr. Goodluck Obi, one of the members of SFH Access Board. So welcome to CoElevate launch.
Thank you.
All right, so as one of the big boys in KPMG and digital health, what are your expectations? What is CoElevate aiming to bring to Nigerian innovators and innovators across West Africa?
The initiative, the concept of CoElevate, I think it's one that is coming at the right time. We're in a digital space. The world is going. Everything we are doing now is digitalization, and this is just at the right time. And this is novel in the health space where SFH is playing. So number one, this is something that I'm excited about. The leadership of SFH have done so well in coming up with this program and initiative. It's something that I believe will benefit the people of Nigeria, the young people, not just the young people, everybody, to be honest. As we go into AI and all of that, this is just the right time for people to understand and look into digitization of health sector.
Thank you so much, sir, for taking our time to chat with me. Have an amazing experience in there.
Thank you.
All right, so I have here with me Professor Enato. He's the advisory board for CoElevate with SFH Access. Welcome to this event, sir.
Thank you.
All right, so as one of the brains behind CoElevate, what is CoElevate aimed at giving innovators in Nigeria and across West Africa?
Well, it's just providing a platform for smart innovators to actualize their dreams. So in a simple way.
Okay.
Yes. So SFH Access will be providing funds, resources. We identify, and those innovators, and also ensure that they get the funds to seed funds to start their work, and also scale it up. So I think the model SFH is using is very laudable, which is both grant and equity. And the best of my knowledge, I think they're probably one of the best, the first in that area within our own geographical space.
Thank you very much, sir. Okay, so what are the expectations for CoElevate on the long run?
Yeah, the expectations are many, one of which is first of all, some of those smart brains that we have around, so they will be able to actualize their dreams. They will be able to convert their ideas to products, and those products will be useful to the society. Will help to solve social problems and also improve the economic outlook of our nation.
Thank you so much for chatting with me, sir. Please have an amazing experience in there.
Thank you. Nice having you too. Bye.
Okay, so I have with me Dr. Ophili. He's one of the advisors with CoElevate. So why are you a part of this? Why are you a part of the SFH Access Catalytic Fund?
Well, I believe I am. Maybe from the little experiences I have, I've had in life to come to in the SME startup ecosystem and technology. Maybe I should give a little bit of my background. I've worked in various startups. I've started many myself. Some failed, some succeeded. So I'm an entrepreneur. I'm a lecturer. I teach entrepreneurship in emerging markets, in schools in Europe, and taught in Nigeria as well. So I guess it's to bring my experience and background to the fore for what the CoElevate program is about, this particularly in the health space.
Yes.
But principally, I believe in the cause for what SFH Access is about, in promoting innovation and technology in the health space. So I think bringing everything together is, I believe that's why I'm here, or why I was chosen, and I'm honored to be here, and I'm very glad that I was found worthy to be part of this great assignment.
All right, thank you, sir. Okay, so what are your expectations from CoElevate on the long run?
My expectations are that we will contribute our own quota in transforming healthcare in Nigeria and in West Africa. From my understanding, I hope and expect that as we journey down this road, that we'll be able to, in impacting healthcare, we'll be able to identify and people innovations in that space and also create jobs. So create jobs, improve healthcare, and transform the society economically as well, because there's a connection.
Thank you so much, Dr. Philip, for chatting with me today. I hope you have an amazing experience in there.
I believe I will. Thank you very much.